It was in March 2009 that the media spotlight fell on Stafford Hospital. A damning Healthcare Commission investigation found serious failings in the way the hospital was being run, and that levels of care fell far short of what was considered acceptable. In some cases, patients were left in soiled sheets for hours. Critical case notes describing the care given to patients were not written up correctly. And, most worryingly of all, the death rate at the hospital was significantly higher than the average. Between 2003 and 2006, 25% more people died than the expected figure. Following all the criticism, new approaches have now been taken to find out what staff really think, to raise morale, and to see what life at the sharp end is really like. The 12-month update report concludes that the hospital has made considerable progress, with 5 of the 6 improvement conditions set out in the original report now met. A lot of work has gone into improving the accident and emergency department. The ward has been redesigned and reorganised, and staffing levels have been significantly increased.
It was not uncommon for there to be 4 or 5 nurses for the entire department prior to the problems that we had. It was highlighted many times and nothing was really done about that.
I mean, I couldn't believe how often you would go on wards and patients' meals were left out, or they hadn't had a drink for a while, or basic pain relief wasn't given.
The plaster area for fractures that come through that need plastering.
Members of the executive board now conduct regular walkabouts through the hospital to talk to frontline staff and see for themselves how the wards are operating.
This is the A&E department. This is the minors area.
Right.
These are people with minor injuries who come in here.
Okay.
And they need individual cubicle. They have their procedures like x-rays done.
We have been scrutinised to the nth degree, as you can imagine, and it has been irritating at times and very intrusive at times. But we know that this is likely to happen, and I think we've accepted that, people want to know. They want to see the proof that things have changed.
Staff numbers at the hospital have increased across the board. The number of full-time nurses in A&E has gone from 38 in March 2008 to 54 in March 2010, an increase of 30%. In addition to this, new systems have been put in place to ensure patients get triaged and moved through A&E in a more efficient manner.
This is a new process. What's now is that if you look at every single board, it tells you, for example, Cora will talk you through what the patient came in with, how long they've been in A&E, how likely they are to breach, and where they need to go. All that information is visible.
The 12-month progress report states that much is still to be done to improve the management of A&E waiting times, but staff are working hard to ensure patients are treated inside the 4-hour breach mark. Another innovation is the establishment of a pit stop area. Within this zone, patients arriving at A&E are quickly assessed to identify the severity of their condition.
The consultant will see them quickly. Within 15 minutes, they will know a patient needs to go home, go to the majors area, go to recess, or go to the surgical assessment area.
And previously, that was just being done ad hoc by the reception staff, wasn't it?
I think the reception staff didn't quite do this, but the perception was they waited at the front area for the receptionist to summon a nurse. Now the nurse triages them 24/7. So even at night, when a patient comes in the recess in the front area, the nurse will be sent for to do the triage.
The cover here is much higher for this size of hospital. In most small departments, you'd have a consultant around, but often they're only on the shop floor, maybe till 6-7 o'clock in the evening. So here we give a much longer period of cover, which obviously benefits the patient and provides care for a longer period of time.
This is the surgical assessment unit, where, like I said, patients are admitted to individual cubicles. The nursing staff will do the assessments. The medics will come and do an assessment before they're either discharged back to home to the GP or to a ward for a surgical procedure.
Poor levels of cleanliness and hygiene were 2 of the issues highlighted in the Healthcare Commission report, and the Trust has worked hard to improve things.
I think one of the first things that strikes you when you walk into the hospital is how clean the hospital is. Cleanliness is not just making sure the floors are clean is part of a much wider thing in terms of protecting patients for healthcare-acquired infections.
Despite all the flack the hospital has received, many members of frontline staff have stayed on, and the general feeling is that the working environment and the level of patient care has significantly improved.
From what I've seen from what I've witnessed and the feedback that I'm getting off regular people that come into A&E, you know, it's getting better.
Having more staff now, it makes a big difference. And it doesn't seem like they're working any less though. They're still under a lot of pressure and there's still a lot of work to do, but inevitably it will have improved patient care.
People are understandably concerned because of all the history. I think I'd quite like to put some of that history in the background and get on with providing good care.